Hello everyone, it's Veronica again. I'm going to speak about the bulimia nervosa and the beige disorders. I'm going to combine the two of them because they are very close. What is bulimia nervosa? Bulimia nervosa, this is where people typically alternate dieting, eating only low-calorie foods. They usually call them safe food. It's not safe food. With binge eating on forbidden high calories food. What are these high calories food that they usually call them safe? They don't feed on high calories feed, they feed only on the low calories feed. What is binge? Binge is eating large amount of food in short period of time with a sense of loss of control over the food. You have eaten until you are full. You don't have control on that, on what you have eaten. That is what I mean by binge eating. And these patients, they usually tend to be secretive, and they usually feel shameful and embarrassed because of their feeding habit. Binge occurs at least weekly. It can occur several times in a week, but at least a week, and it's followed by compensatory behavior to prevent weight gain. Bulimia nervosa, they have the binge eating and they want to compensate that eating. I hope you have understood that one. These persons are excessively preoccupied with thoughts of food, weight, and shape. I want to eat safe food, I want to maintain my weight, I need to maintain my shape. That is what is occupying their mind a lot. Can be slightly underweight, they can have normal weight, they can be overweight, they can be obese. All of them. It's impossible to tell this person whether this person is suffering from bulimia nervosa because they tend to have all those characteristics. They can have one, they can have the other one. If they have underweight, you will start confusing with other feeding disorder. If they have normal weight, they are normal. If they are overweight, you find that you can confuse them with having binge eating disorder. So, which are the possible symptoms that you look in this patient? This patient frequently tries to go to bathroom frequently. They want to go to bathroom all the time. What are they going to do to bathroom after meal? To go and induce vomiting. Or they go have taken laxative to go and diarrhea the food that they have eaten. They usually eat large amount of food. That is another symptom you are supposed to note. And the other one, there is, if you go to your house, you find large amount of food are disappearing from the house. You will find wraps in the dustbin. You might find food wraps, and we are not seeing that food. You can also note they have chronic sore throat. It's a sign. They have chronic sore throat. They have swollen salivary glands, and the cheeks, they are swollen. They can have dental decay, which might be caused by the stomach acid. They have heartburn and reflux. They have a lot of use of laxative and diet pill. These patients have recurrent unexplained diarrhea from misuse of laxative. They also misuse of diuretics. Also, they have dizziness. This dizziness is from dehydration. Remember, these patients are inducing vomiting. These patients, they are diarrheaing. And this dizziness can lead to electrolyte imbalance, which is one of the complications. There are those complications which are from the bulimia nervosa. One of them is electrolyte imbalance, which is caused by the kidney failure. We have said that these eating disorders can lead also to esophageal tear. It can also lead to gastric rupture. They usually have cardiac arrhythmias and tooth decay, secondary to stomach acid because of the vomiting. The treatment for bulimia nervosa, it's only the cognitive behavioral therapy. Talking to them about changing their eating habit. Okay. Now we have the binge eating as a disorder. No, it was in the Birumia nervosa. It was in Birumia nervosa. In Birumia nervosa, binge eating disorder, which I said that it is consuming large quantities of food in brief period, experiences of loss of control of their eating habit. They eat a lot, faster, excessive, but they don't have the control of that. That is what I'm calling the binge eating disorder. Now the difference between binge eating disorder and the bulimia nervosa. We have seen that in bulimia nervosa, they have a compensatory mechanism. They have to compensate. They have eaten a lot of food, so they have to compensate to remove it. That is why these patients, they tend to be, some of them, they tend to have underweight, others they tend to have normal weight, others they tend to have overweight, obese, because of that compensatory habit of like vomiting or like using of laxative to diarrhea or misuse of diuretics. But in binge disorders, they don't have that compensatory or the alternative way of removing that food. They just eat and eat and eat and eat everything that they find, and even they don't get full. Eating, then they get full. After a very short period of time, they start eating again. What are the characteristics of the binge eating disorder? One of them, eating more rapidly. They eat uncontrollably, large amount of food. They eat alone. They feel disgusted with oneself. They feel depressed, and they feel like they want to stay alone. They want to eat alone. They don't want to eat with other family members. They are just alone. Those are some of the characteristics that you can note in a patient with the binge eating disorders. And this one, now it's going to complicate to those diseases which are caused by overweight. Eating a lot will lead to overweight. Which are these diseases? They can lead to hypertension or cardiac failure. And by there, I hope I've said something of importance to you people. And thank you so much for listening to me. If you haven't subscribed, subscribe to my YouTube channel and keep updating yourself with these mental illnesses and other illnesses. Thank you very much. Bye.